Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. I am Professor Ahmed Adam. You are welcome to this parasitology lecture. It is about Diphyllobothriasis. Diphyllobothriasis is a parasitic disease caused by the tapeworm Diphyllobothrium latum. Diphyllobothrium latum. It is also known as fish tapeworm or broad tapeworm. We are going to know why it is so called. This worm is found in areas where people eat raw or undercooked freshwater fish. It's found in Russia, Europe, North America, and even found in Africa. Now we come to the life cycle, starting by the infection on your extreme left hand side, number 1, where the arrow is pointing, the large arrow. The infection takes place by ingestion of the infective stage, which is known as pleurocercoid larva. Pleurocercoid larva. This is found encysted in freshwater fish, in the meat of the freshwater fish. After ingestion, in the small intestine, scolex with the head of the pleurocercoid larva will be freed and attaches itself to the small intestine mucosa. And then look, number 3, it grows into adult in the small intestine. So the worm lives in the small intestine, and we know that all cystodes infecting human beings live in the small intestine except Echinococcus. Number 4, segments are detached from the adult worm, the distal segments, the segments far away from the head, and commonly disintegrate, that to say they rupture in the intestine, releasing eggs. These eggs are unembryonated, immature eggs. The eggs are passed in stool. If this stool happens to be passed in fresh water, the unembryonated eggs will become embryonated, that's a mature eggs. And then look at number 7, the mature eggs hatch, releasing coracidia, singular coracidium. These coracidia swim in water until ingested by the crustacean, which is a small creature found in water, and it is the first intermediate host. So our worm has got 2 intermediate hosts. Inside the crustacean, the coracidia develop into procercoid larvae. And then the crustacean containing the procercoid larvae may be ingested by freshwater fish. The freshwater fish is the second intermediate host. The ingested crustacean will be digested by the freshwater fish, except the procercoid larva. The procercoid larva develops into another larva known as pleurocercoid larva. This pleurocercoid larva will become encysted in the flesh or the meat of the freshwater fish, and it is the infective stage. And here we complete the life cycle. Now the pleurocercoid larva, which is the infective stage, is encysted in the muscle of the freshwater fish. And then from number 12, you can go to number 1, that the infection will take place by ingestion of the fish containing the pleurocercoid larva. Now let us see the adult worm. It is a long worm, about 15 meters long. containing about 3,000 segments. Also, the segment is known as proglottid. This worm can live in human up to 20 years, in the intestine of human for up to 20 years. It releases per day high number of eggs, about 1 million eggs per day, passed in stool. The incubation period ranging from 2 to 6 weeks. The incubation period is the duration of time from the time of infection up to the clinical manifestation of the disease. This disease may be mild and even asymptomatic, or abdominal pain of different or of varying intensity. And we know that the small intestine is a site of digested food material. This worm feeds on the food, so it shares food with the patient, and especially vitamin B12. It sucks vitamin B12, leading to vitamin B12 deficiency, and the patient may present with megaloblastic anemia due to this deficiency. Also, the worm is tall. It can convolute, wound, and obstruct the small intestine. As we know, anatomically, the small intestine has a small lumen. There will be intestinal obstruction, which may be a surgical emergency. Also, there will be disturbance of the bowel function or the bowel habit, so the patient may experience vomiting, diarrhea, constipation, so alternating such disturbance in the bowel habit. And also, the patient will be jeopardized of the nutrients, and especially if the patient is already malnourished by other reasons, this will aggravate the condition, leading to weight loss. Diagnosis. Before diagnosing this, we have to put in mind the epidemiology or the distribution of the worm. So we have to suspect it. If we don't suspect it, we will not diagnose it. So we know the distribution of the worm. So if in an area near the sea where people eat raw or undercooked freshwater fish, we have to suspect the presence of the disease. And the concrete diagnosis will be by finding eggs in stool. So microscopic examination of the stool may reveal eggs. The eggs are very many. Even the stool does not need concentration to increase the yield, because the number of eggs passed in stool is so high. Characteristically, the egg is oval shaped in one pole. It has got a lid or operculum, so we call it operculated egg. You see here, the arrow is pointing to the operculum. Also, if a segment or a chain of segments are passing a stool, we can examine that, and here we see that the worm is broader than taller. You see a segment, you look here. The segment is broader than taller, so it is known as the broad tapeworm. And also the fish tapeworm, because the freshwater fish is the source of infection. For this reason, the worm is also known as fish tapeworm. Treatment. Any of the coming drugs will kill the adult worm. Praziquantel, this is a drug of choice, followed by niclosamide. Prevention by proper fish cooking. So you have to cook the whole meat, the whole fish, And the temperature should reach the core, not just the surface, at least 55 degrees Celsius. And if the fish to be stored, that is to say, to be deep freezed, at least minus 10 degrees Celsius. The other thing is by personal and environmental hygiene and safe sewage disposal, safe disposal of human excreta. By this, the lecture is over. I hope that it is understandable and I wish you all the best.